Yes, I manage ACE Centre, which is a charity actually based in Oldham. Has anybody had any contact with ACE Centre yet, past or present? Well, we are a national charity and we have recently been involved in the delivery of new NHS commissioned services for children and adults who have little or no speech and who rely on technology to help them communicate. A little bit about ACE Centre. We've been in existence for quite a long time, about 30 years now, and the technology has evolved dramatically over that period in time, and we have been providing assessment services, training services, information services to people who are interested in finding out about a field known as augmentative and alternative communication. It's awful jargon, so if I slip into jargon, tell me off, please, because it's not helpful at all. But it's a field that has evolved recently around technology to help people to communicate. And by technology, I'm talking about a whole spectrum of paper-based systems, sign-in systems, battery-operated simple devices, right up to very sophisticated computers that you can control through your eye movement to be able to speak messages and to give you an electronic voice. So there's been a massive evolution in all of this technology in the time that I've been at ACE Centre for the past 20 years. There were about, I think, 3 or 4 communication aids, as we call them. You can't be a good old-fashioned campaign. I'm with you. I'll come back to that point later on. Absolutely. Absolutely, yeah. There's iPads as well, absolutely. But there's been so much out there now that actually it can make a massive difference to people's lives. However, it's not as straightforward as people think it's going to be. We sort of fall in love with technology, as is beautifully illustrated. It doesn't always work as you'd like it to. It has a tendency to let you down when you don't want it to. And I'm with you. I'm on paper-based systems. I do think actually we underestimate the value of some good old paper-based systems. And I've got some here that I can show you a bit later on.
What did you prefer?
But there has been such an explosion in this technology. What there's not been is an explosion in budgets for people to have access to it. So even though you can get a hearing aid if you've got difficulty with your hearing through the NHS, or if you're having difficulty with mobility, you can have a wheelchair. If you're having difficulty with speech, up until recently, you wouldn't necessarily get a communication aid to support you to speak. So there's been lots of campaigning to try and get better funding for people who need what's called AAC, this field of technology, both paper-based and electronic technology, to help people to be able to communicate, to express themselves. So that campaigning has been gaining ground over recent years and has culminated in the funding being released by NHS England for what are called specialised AAC services. So my organisation, ACE Centre, is one of the services that's been awarded a contract to provide assessments and equipment to people who are eligible for those services. And for me, that's an absolute joy, because for many, many years, we've been in existence for a long, long time. People will come to us to say, my son or my partner is not able to communicate. We could show them what's out there, but what we couldn't do is give it to them, because we just didn't have that funding in place then. Now we do, and that is amazing, because it takes that headache away from the people who need it, the families who need it, the professionals who are supporting people to use it, to not only have to work out what they need, how they use it, which one to get, but then to have to go and get the funding for it as well. That headache's now all sorted, and ACE Centre will provide that equipment for children and adults who need this technology. The people who use it, some are people, we work with a lot of children with lifelong conditions like cerebral palsy, for example, but we also work with people with acquired disorders of brain injury, head injury, spinal injury, but also people with neurological conditions, including people with motor neurone disease. So there has been a lot of work going on in the past year and a half to get these services up and running, to make sure that people who need it can get that support as quickly as possible in a timely way, so that they've got the equipment when they need it to be able to continue to communicate to their loved ones, to the support assistants, to the professionals that they're having to deal with. And so I'm going to talk to you tonight a little bit more about that and give you a bit of background to it. So, lots of campaigning. MND Association has been incredibly helpful with this as well. Scope has done a lot of campaigning in the past around this. My charity, ACE Centre, has campaigned for a long time around this, and I think actually we probably punched way above our weight in terms of getting the profile for this. Bearing in mind the current financial climate and the pressures on the NHS, to get some new money for this service is pretty amazing, really. So that's the good news. The challenges around that, to get the services up and running and get the equipment out there to the people who need it in as effective way as possible. ACE Centre is being commissioned by NHS England to provide services across the northwest of England. So if you live in the northwest and you meet the eligibility criteria, which I'll talk about in a moment, then you can be referred to our service. We will come out, provide an assessment from our service delivery team of speech and language therapists, occupational therapists, and teachers and clinical technologists, and we will identify what equipment we think is probably going to be best for you to use. You will be central to that process of making that decision, but we will then leave that equipment for you to try for a period of time. If you're happy and you feel that's the right piece of equipment for you, we can then leave it on a long-term loan basis. If there are any problems with that equipment, it's our responsibility to sort those problems out for you and try and take away all those headaches of equipment breaking down when you don't want it to. So the challenges around that, which I'll explore in a little bit more with you shortly, are that we are commissioned to work with those people with the most complex needs. So, for example, somebody with motor neurone disease at the early stages who still has some functional speech may not necessarily be eligible for us immediately. It's really when their needs are more significant that we would then get involved. But it doesn't mean that that person doesn't need some support and professional advice around helping them to be able to communicate. And that is reliant on good local services, local speech and language therapists having the skills and knowledge to be able to support somebody and their family to help that person to communicate with things like paper-based systems or some of the iPad apps that are currently available, or some of the simpler text-based communication aids where you type in and you speak a message out. That typically will be provided locally. We would get more involved once somebody's needs are a little bit more complex than that. So we're working with local speech therapy services and with occupational therapy services across the Northwest Wheelchair Services to try and look at integration issues of all these technologies as well. And so the people who would be referred to us would meet eligibility criteria that's been defined by NHS England. It's not ACE Centre who's made this up, it's something that NHS England has decided upon around an individual who would have access to our service would have a severe or complex communication difficulty associated with a range of physical, cognitive learning or sensory deficits, and a clear discrepancy between their ability to understand what is said to them and their ability to actually express and speak. So in addition, we would not work with people with very significant learning disabilities, but we would expect them to have had some experience of using low-tech systems already, like the whiteboard that you held up there, or some of these that resources that I've brought along here with me as well. And then once we're happy that somebody meets the NHS England eligibility, we would accept them. And usually people are referred to us through speech therapy services, particularly if you have MND. Almost all of the referrals we would get through would typically be from a local speech and language therapist. Working with the family and the person to give us sufficient information to be able to come out and do an assessment of what you actually need. And the better quality information we get, the better prepared we are when we actually come out to see you. There has been huge expectations for these services, and we've also had quite a big waiting list to deal with for quite some time. So we've had to put in place some prioritisation criteria. And actually somebody with a rapidly degenerative condition, for example somebody with motor neurone disease, would be given priority. So once they are defined as eligible for our services, they will be fast-tracked on our waiting list as well. So you go up to the top of our waiting list, and we would aim to try and see you within a couple of weeks. Obviously, that varies depending on how many priority referrals we get through at any one time, but typically we would aim to get out and see that person within a couple of weeks, and we will be liaising with the family and with the speech therapist and any other professional it's sensible to involve to set a date to come out and see you, and we'll bring a whole load of equipment with us, if that's appropriate, to have a look at, to try on the day and to evaluate, and we will build that assessment, that initial assessment around that person in terms of whether they get tired, they need a break, and perhaps we need to sometimes come and spend a little and often to try and look at different options, or we might spend a concentrated period of time looking at a whole range of things in one day. It varies really. But the important thing is to bear in mind that we would prioritise a referral for somebody with motor neurone disease. We get lots of people referred to us who are not yet eligible for our services, so they may still have functional speech, and we can't accept them at that stage. Personally, I would love to be able to accept people straight away, to give them the choice of deciding if they want to look at what technology might be able to help them in the future.
What do you call functional?
Functional speech. It's very hard. All of this is very, very difficult to anticipate and expect.
It's just that I was with somebody in clinic today whose speech is very difficult to understand, and his friends are not visiting anymore because they don't understand him. To me, that's not functional speech.
Yeah, that's fair enough. And what typically we would do is have a discussion with the referrer and get them to evidence the difficulties that somebody is having. And we don't come up with hard and fast rules. Everyone is considered on a case-by-case basis.
The fact that his wife can understand him just about is irrelevant in a way.
Yeah. Well, for some, and it's also what that person wants as well. So for some people, even though their speech may be difficult for others to understand, they may not care. They may say that is somebody else's problem and not theirs. And they may not, at that point in time, be ready to accept technology to support their communication. Some people want it, some people don't. Everyone is different, and we have to try and respect that.
What your definition was? Because
typically, if we get a referral through for somebody who is able to get their message across pretty well, 75% of the time, we have to prioritise those people who are not able to do that at the moment and see them as soon as we possibly can.
Because we work on quality of life, and if people aren't communicating,
they
haven't got functional speech.
Absolutely.
So
and we would say that we would, if in that instance, we would absolutely, we would. But I think we're very mindful of the need to treat everyone as an individual, and everyone is different. Some people don't want to know about what technology they might need in the future. They're not ready to consider that. And that's fair enough. Yeah, absolutely. We would have to respect that as well. Some people want to know, but they don't want all singing or dancing technology as well. They want something that's simple and effective and easy to use, and that the people around them can use with them to communicate to. So everybody's different, really. But it's a very valid question, because a lot of the time we're making difficult decisions, because somebody may have functional speech or
This
good...
week, but not next week.
Exactly, absolutely, and none of us have got crystal balls and are able to decide that really.
But we know that it's going to get worse.
Yeah, absolutely.
You know, so
But
it's
it might be
delayed
weeks,
things,
it might be
really
months,
worse.
yeah, absolutely. And what we have to do is make sure that we give priority to those people who genuinely, absolutely need it now, and so we're making those judgment calls all the time, and that's not easy at all. And all we can do in that situation is have ongoing discussions with people referring into our service, with the expectation that they know that person well, and that it's their judgment call to guide us around that person's needs. Because we don't over talk, you know, we are totally
speech and
reliant.
language therapist who's known them for a while would know exactly the rate that things are going.
Yeah. Well, they've got a better idea than I have. So typically I would say, give me some information about what's happened in the last couple of months. Because whilst that's not necessarily going to predict anything, it's better than nothing, isn't it? You know? So we really do try and deal with every referral on a case-by-case basis. And as I said, ideally I would love us to be able to see people immediately if they wanted to. Unfortunately, we're not at this point in time commissioned on that basis, but I also think we still need to make sure that local speech therapy services have got the skills and knowledge to be able to support somebody with the early stages of communication difficulties. So part of what we should be doing, and we are trying to do, is not just provide assessments ourselves, but provide training to local health professionals to make them better aware of what some of the technology solutions might be. I know, I accept that, I do, absolutely, and that's why in certain instances we would respond absolutely, and that's why we would give priority if we need to. The comment made was we don't have time. We didn't see that.
That must have come from John.
So my next point was the timing of referrals is very challenging for all concerned. That point exactly. And ACE Centre is reliant on the judgment of the referrer to evidence the rate of deterioration and the level of functional speech. That's exactly the bullet I just put. Yeah, absolutely. I think there's a risk also of referrals being made too late as well. So again, when we're talking about timing, it's not just about people being referred to as too soon. If people are referred too late, I think there is a point where actually that is too overwhelming, the prospect of having to learn a new technology and get familiar with how to use it, and they're not necessarily as easy as you'd think to be able to use. So we're very mindful of the need to try and, again, on a case-by-case basis, anticipate each individual's needs as best we can, based on what that individual person's expectations are, and their preferences are as well. And that just involves ongoing discussion with referrers and the families and professionals working with them. I do hope that in the future, when we've got a bit better data behind us, national data, better evidence base, we can look to offer that kind of service in the future so that we can give people the opportunity, if they want it, to have access to the technology before they need it, so that they can get familiar with how to use it, feel comfortable with it, without having to be overwhelmed by that later, at a later stage. But at this point in time, the skills and knowledge of local speech therapy services is hugely variable around the North West. It really is. We have always done some training on initial speech therapy degree courses, and I think typically speech therapists are on a 3-year degree, sometimes 4-year degree course. We do half a day. You know, and there is so much out there, there's so much technology out there. And that's if we're lucky. Sometimes it's an hour on some speech therapy courses, degree courses. So speech therapists are coming into jobs really having had very little training around this area. bearing in mind it's a rapidly evolving area with the technology changing all the time as well. And the best we can do is say, there's this place called ACE Centre that will try and help you, and this is where you can go to this website for resources and support as well.